Thanks for Douglas' nice introduction. Good morning, everyone. I'm very glad to be invited by Dr. O and the Symposium organizer to be here to share our very primary experience or primary practice on the AI application in the medical oncology, because I'm a medical oncology in Shanghai 10th People Hospital. So as we know, right now the AI is entering our daily life in a very fast speed, especially in some entertainment fields such as AlphaGo, as well as one of the Chinese Weiqi champion for several times. As for the medical fields, there are many huge or large enterprises are developing and on research on some fields, such as GoogleNet on pathological examination, Sophia Genetics on gene mutation analysis, and Enlitic on imaging diagnosis of tumor, and Oncology on radiation oncology, and Isolical medicine on tumor drugs research. And today my topic is on the clinical decision supporting system. Is products of Watson Health. IBM Watson is a clinical decision medical oncology supporting system. Is a tumor therapy advice suggestion system. And right now, you know, in China, the doctors are facing many challenges. The overall clinical workload, the high requirement for scientific research, and doctor-patient communication is under great pressure, especially for medical oncology. They are not specific on definite one cancer type. That they are going to try to cure, to do the treatment for many kinds of tumor. So they may be face many challenge for the updating of professional knowledge, so they need the assistance. And this year, on January, the Nature Medicine published 9 articles on AI. It seldom happened before. One issue, 9 article. So probably it is a beginning or is a signal of a new era or new area. And this year, ASCO, there are 40 articles on artificial intelligence, and IBM Watson for oncology is 16. And today, first, Watson for oncology, brief introduction. What is Watson? What is Watson for oncology? It's trained by the MSKCC, the Memorial Sloan Kettering Cancer Center, for more than 4 years. It helps oncologists make treatment decisions by providing evidence-based, personalized, and prioritized treatment plans. As for its knowledge, it from more than 300 medical journals, more than 200 medical books, and more than 27 million professional papers. As for the database, its data bank is MSKCC, the best clinical practice. Is a large number of cancer treatment cases, and it's trained by the experts on every cancer professional fields. And it updates regularly. It's developed with a rapid change cancer treatment progress and research result. Update probably every 1 to 2 months. And this is the outlook of the Watson for oncology. Right now, it can provide 13 cancer types treatment options proposals. It's breast cancer, lung, colorectal, gastric, cervical cancer, ovarian cancer, prostate, blood, thyroid, liver, and endometrial and esophageal cancer. It's 13 types right now. We're looking forward to more options, more cancer types. And it generates treatment plans and treatment plan recommendation, NCCN guideline recommendations, and it's linked based on the evidence-based study. It will provide a timeline view of the treatment plan, showing the duration of each part of treatment, such as chemotherapy, radiation, and surgery. It's showing evidence-based options, and it will give us clinical trial searches, and it will at last export, print, hard copy of the available. It's available for the patient. Can give patient some education materials. From the picture, we can see it can give 3 options. Is first, recommendation. Second, think about it. And third, no recommendation. And right now, there are more than 150 hospitals and institutes get the contract with IB Watson. In China, there are 103 hospitals, medical institutes in 53 cities of 24 provinces in China in 2019. And our hospital, Shanghai 10 People's Hospital, is the first hospital to use IB Watson routinely in Shanghai. So second, Watson for oncology, application scenery. There are 8 main application scenarios. There are decision reference, second opinion, teaching tool, learning tool, academic conference, MDT, cancer patient and doctor's communication, and quality control. Just now we mentioned that there are 13 cancer types can be used in Watson for oncology. It's a decision reference. Watson for oncology may not be better than the top experts in their field in every cancer subdivision. But if we put together 13 cancer types, species, WFO, Watson for oncology, will surely be better than any top experts. Sorry. And it's an all-around champion. It's not a single champion, but it's an all-around champion. Second opinion. Even in Shanghai, the patients, when they had a diagnosis of carcinoma or cancer, they will go around Shanghai to get opinion one by one from one hospital to other hospital. So use this Watson for oncology, we can have the remote consultation of superior and subordinate hospital to have a discussion, to have a MDT. Watson provide decision-making reference and evidence-based medicine. And we also can use it with a teleconference, cross-regional and multidisciplinary exchange of experts from multiple hospitals in Shanghai, even in Shanghai or other areas such as Zhejiang, Shandong, or Jiangsu province. We can have a conference meeting by the platform of IB Watson. And we can also use it for the international remote consultation. And we use it to teaching or affiliated hospital in such as Henan and other far from Shanghai hospital. Teaching tool. Right now the information a lot of, and the young doctors, they will have the cell phone to check the new information and new guideline. And with IB Watson, we can we can have a very formal or rapid teaching tool. Teaching tool is a teaching, we can use it for teaching rounds, explain cases with real case, and we can use it with a training tool to as learning assessment tool for case analysis and for case study also. It's very, I think, useful for young doctors. They like it. They like it. And at first, we use MD Watson for MDT in our hospital. Because in China, MDT is a kind of a new stuff. At many meetings, only one people decision the final result, decide the final decision, make the final decision. But use Watson for oncology, use the artificial, we can ensure the accuracy of a general direction. It's kind of a GPS for a driver. They can tell you where should go. And 2018, we published an abstract on ASCO. It's about the establishment of a new medical model for tumor treatment combined with Watson for oncology, MDT, and the patient involvement. We use Watson for oncology, we can have more time to explain the detail of treatment regimen. And the learning tool. It's trained by the MSKCC, so it has a characters of MSKCC's study or clinical trials results. For BSI, the bone scan index, we seldom meet them before. When we use it, we can see this word. So that is a formula for treat the bone metastasis of cancer. The M is the number of bone metastasis, R is the number of involved bone anatomical areas, and C is adjustment factors. So it's a very good learning tool for patients, for doctors. It's a combination of ACC guideline, ISMO recommendation, and a textbook of such as MSKCC's experts study. Conference. Watson participated in large-scale academic exchange conference in hospital, regions, and the whole country, promote the academic promotion of tumor diagnosis and treatment concept and technology, explore the new clinical diagnosis and treatment models in the medical field, share the practical experience, and led the development of artificial intelligence medical area. We use it in the China Medical Education Association and the Chinese Clinical Oncology, Chinese Society of Clinical Oncology, and we ASCO. Complication. In mainland China, the cancer patient population is very huge. So for doctors, they can't have enough time to communicate with the patients. Use Watson for oncology, we can have more time. We can have more chance to explain the detail of the treatment plan. So their satisfaction improved. And the quality control. Yes, the doctors in China mainland, the workload is very heavy. So use this kind of tool, we can give the doctors to let them quality control better. Okay, so third, medical application of AI, ASCO reports. This year, there are two interesting articles published in ASCO. One is from India. It's a prospective blind study of 1,000 case analyzing role of artificial intelligence. Watson for oncology in change decision making of multidisciplinary tumor board, MDT. from an India center. It analyzed 1,000 cases. The coordinates of patient AI in rectal cancer is 30%, and breast cancer is 92%, and lung cancer 89%. But there are some difference. In the non-coordinate, the MDT changed the decision in 13.6% of cases. Why? Because the evidence for newer treatments, because of more personalized treatment alternative, because new genotypic, phenotypical, and clinical insights. So that is the reason. And another article is from Brazil. It analyzed prostate cancer, and the discordant is 31%. And among the discordant cases, 53% because of the patient preference for treatment versus active surveillance, because prostate cancer develops very slow, but they prefer treatment. And during the past time, the concordance study a lot of study the consistency of and the coincidence rate between the treatment strategies of Dr. Tim and Watson for Oncology, and it tried to help to analyze tumor types and stage with better support for WHO at this stage, and try to find out the causes of difference and analyze the solution. But this year, something changed. There are 10 articles from China, and totally 8 in world and 4 in China. And we Shanghai 10 People's Hospital have 2 articles from the on quality control and the remote consultation scenery. It's not only the coordinates analysis, but also some new area. And we published one poster. One is AI quality control. Even the AI should be under the quality control, and we use that for the remote consultation for affiliated hospital. And we also use the Watson from genomics for the genomic analysis. So 2 poster and 1 abstract this year for hospital. And one we use for the quality control system of Watson for Oncology. It's AI for supporting clinical decision in oncology. We use a form sheet to try to control the quality of AI. And we use it for teaching and remote consultation model for all other hospitals. And we also use Watson for genomics, is another AI, to analyze the Chinese acral and mucosal melanoma patient genomics and the new antigen profile. Because in Western country, the melanoma usually happened on the body, but in China it's different. And the mutation rate is different also. We use the AI. So last, the future outlook. Yes, right now there are many enterprises such as Roche, Google, and Philips, and other enterprises are developing and do the research on AI to use it for medical fields. Right now we cooperate with the Roche Diagnosis. It's a Navify. It's a Navify tumor board workflow solution, customized for cancer medical team. In China, we do the MDT, the information a little bit mass, a lot. So we need a model to try to organize the standard model we use for the MTT. It can give the high efficiency for a medical team, simplify the preparation and demonstration of tumor board, improve the collaboration and supporting develop individual medical strategy. Is a Navify tumor board, kind of a APP software. 2 APP. One is a clinical trial match APP. Another is a publication search APP. Through the MDT, we can get some information. And that is Outlook, a software research. This year, Nature Medicine also published another article is on the small nodal in lung to analyze is malignant or benign. But right now, for our medical oncology, it's a hard work for every time to try to figure out the size, the tumor, to calculate the tumor size. So we right now use Philips multi-modality tumor tracking. It can calculate the tumor size, the diameter, and the size of the volume, and even the density. We can use it. It's Outlook, yeah. Evaluation of tumor therapeutic effect based on the international standards. It can process images of virus imaging devices, CT, PET-CT, MR, automatic registration of a lesion, 3D commented mapping of lesions. It's the picture. MMTT, yeah, it's a quantitative evaluation of a tumor volume. Yeah, things are birth of Watson for oncology. There are many different voices on the AI application in medical fields, on medical oncology. But Watson advised doctors on assist diagnosis, whether in China or the United States. Doctors are the last ones to make the decision. Yeah, the doctors make the decision. Even the IBM can give you many suggestions, but the doctor make the final decision. An important supplement tool that can compensate for the doctor's lack of knowledge or experience will never be regarded as a totally dependable. Watson's expectations are so high that Watson can even be upregulated to the level of replacing doctors, resulting in a gap. In fact, any new technology will have this process before it comes to maturity and application. It's ongoing, it's keep going. Just like the very famous economist Joseph Impeta said, the railroad was not built by the owner of the wagon. Even in some new technology invented, such as the invention of a stethoscope in 1916, was the most fiercely criticized in the history of the scientific committee at that time. Till in 1838, it was only 20 years later that it was accepted. And the ultrasonic had the same situation. 1990, the American Journal of Obstetrics and Gynecology said the use of ultrasound in pregnant women during pregnancy can lead to unrealistic expectation of doctors and the medical system, resulting in inappropriate legal liability and eventual harm to patients. So the general trend is irreversible. The oncologist who use AI will be more powerful in the future. Thank you. Thanks for attention.